SOSSAH and St. Anthony's Hospital has begun another educational outreach program to senior high schools across the Ketu North Municipality. The outreach program formed part of SOSSAH and St. Anthony's Hospital's collaboration to intensify education on the fight against COVID-19 as the country started recording the Indian variant of the virus. The team made their first stop at Dzodze Senior High School and later moved to Wovenu Senior High Technical School, where they educated students on the new variant of the virus, COVID-19 vaccine, and the vaccination processes, stressing on the safety protocol as well as donating face masks and carbolic soaps to the two senior high schools. Speaking to the media, a senior public health nursing officer at St. Anthony's Hospital, Dzodze, and SOSSAH team leader, Madam Quist Justine, called on all health educators, non-governmental organizations, and other stakeholders to organize more outreach programs to intensify education on COVID-19 as the country started recording the new Indian variant of the virus. Madam Quist noted that their main aim of reaching out to all schools in the municipality is to educate the pupils as part of measures to prevent the spread of the pandemic, with much focus on the COVID-19 vaccination exercise. She also observed that the total disregard for the COVID-19 safety protocol among citizens, including residents in the Ketu North Municipality, is worrying and need an urgent attention.
We've been embarking on this outreach program for some time now. We've been to the basic school and we deem it necessary to move to the second cycle institution to educate them on the need for them to adhere to the protocols, as well as the need for them to be vaccinated with the COVID-19 vaccine. These days, people disregard the COVID-19 protocols. People put on the mask only when they are about to enter a healthcare facility, or they wear the mask if they want to enter a bank, or they put on the mask if they want to cross a border, since we are closer to the Togo border. So you see someone putting on the mask, the moment the person crosses the border, the person removes the mask. Under normal circumstances, we must always adhere to the protocols. Few people who even wear the mask are being tagged with names. Some are even mocked. Currently in Ghana, there are new variants of COVID-19, and if care is not taken and there is a third wave, we may not be able to manage the mortality and the morbidities. Hence, the need for us to embark on this outreach program to educate the people on the need for them to adhere to the protocol. Thanks to Anemic and Co, Evans Bosodia, for their support to make this project a success. Today, we've taken the students through vaccination process, the reason why they need to be vaccinated. Also, we actually let them know that when you are being vaccinated with the COVID-19 vaccine, it reduces the severity of the COVID-19, as well as reduces the mortality due to COVID-19 in people with comorbidities. COVID-19, as we all know, has come to stay, and we still need to adhere to the protocols. Currently, St. Anthony Hospital, we have started recording cases, and we are pleading with the students as well as the general public to adhere to the protocols so that the cases will not outweigh with the health workers. When the vaccine comes, we've encouraged the students to make themselves available to be vaccinated so that we will achieve our herd immunity as a country.
Godwin G.K. Dovlo, a senior assistant physician from St. Anthony's Hospital, took the student through education on the vaccine and how important it is for all qualified persons to partake when the next vaccine arrives.
The COVID-19 outreach program is very, very important, especially around this time where we have the Indian strain in the country. A lot of our students are more of dependent on their parents, and especially as they are in school, they've come from different homes, and a lot of them have probably had interactions with their environment before coming here. Whatever information we give to them in the school, invariably that information sends to their family. So even to their friends and their parents at home also get the information. There are a lot of myths and perceptions about COVID-19 and even with the vaccine. So this is the right time for us to go out and give outreach programs and education to our students, because they are the future. and whatever knowledge we impact on them now will affect our future. So it's very, very important for us to do this outreach program. Some of them will serve as instruments for change, especially at home, in school. Some of them are day students who go back to their homes and interact with other people. So the COVID-19 safety protocols, it will be important for them to adhere to them. A lot of them are in dormitories, a lot of them are in classrooms. It's important for them to stick to these protocols so that we can limit the spread of COVID-19. You can imagine how many students are in a class. You can imagine how many students are in one dormitory. So if one child is infected, it will spread very, very fast. So these students are important risk group that we need to educate.
The team also took the students through an interactive section where discussions were made regarding myth and misconception about the vaccine. They further advised the students to disregard all myth and misconception surrounding the vaccine and serve as ambassadors in their various society to get parents and the general public vaccinated. Raymond Asafo, a physician assistant at St. Anthony's Hospital, was very impressed with the students' reception.
I spoke about the general knowledge of vaccine and had to talk about what vaccine is, components of the vaccine, and then processes through which vaccines are taken before they are safe for human use. So basically it was a short interaction with the student, and I think their reception was so warm. You see, usually we underestimate some of these senior high students that they may not be able to assimilate what we try to put across, but then to my shock and then my surprise, I think they were very interactive. I mean, the session was very interactive, and I think it's a good one there.
However, schools authorities in the two senior high schools expressed gratitude to the team for reiterating the need to adhere to the COVID-19 protocol and education on the COVID-19 vaccine. Mr. Adehe Freeman, the Assistant Headmaster of Administration at Dzodze, said the coming of the team is very helpful as it breaks the monotony of they talking to the students all the time.
We're very grateful for the team for coming to continue to buttress what we've already been telling them. In fact, when you look around, you realize that the Arts Department has designed various artworks at various locations, all in efforts to combat the COVID-19 and to help us all, especially now that students are coming from everywhere in school. So coming in just buttress the point or the issue that yes, it is that important, and then a continuous education at all times so that it doesn't become a monotonous thing, one person saying it all the time, but at least different people hammering different aspects, and we appreciate the fact that at least going forward there's been changes along the line, and then we come in, or you come in to give the necessary updates. Students have pertinent issues, you're able to address them. So we're very grateful, and yes, it has been that helpful, and I'm sure if you ask the student the way they participated, they were very excited to have known or learned new things.